One injury you may come across is when someone has fallen badly and suffered from a strain or a sprain. A sprain happens where the muscle is overstretched or torn, or where the tendon is connected to a muscle. A common area to be sprained is the ankle. A strain is where a ligament is stretched or torn, usually where there's been a sudden wrenching motion as the joint has been forced apart, damaging surrounding tissues. Common locations on the body for strains are the lower back or the hamstrings. Ligaments hold joints together and tendons attach the muscles to the bone. Another injury could be where the muscle is torn. The typical example of this would be a hamstring injury, where the leg muscle fibres get torn, causing severe pain and swelling. The main difference is that a sprain, you will have bruising around the joint. With a strain, you will have muscle spasms in the affected area. With both, you may have pain, swelling and limited movement. The first aid treatment for strains and sprains is the same, so it's not that important that you immediately identify what's happened. The treatment we give is to try and reduce the swelling and pain. The treatment is easy to remember with the mnemonic RICE. R, rest the limb. I, apply ice to the limb to reduce swelling. C, provide comfortable support. E, elevate the limb to reduce swelling. Now we'll look at each of these points in more detail. First, make sure the scene is safe and the patient or you cannot come to any further harm. R, rest. The first thing to do is sit the person down or help them to sit or lay them in a comfortable position. Keep the injured limb in a comfortable place, supported, ideally elevated. I, ice. Next, we need to cool the area using an ice pack, a cool pad or a chemical instant ice pack which has crystals in a liquid. With these, you squeeze them to break the liquid and shake it, and then the resulting reaction will cool the pack down. Do not put ice or cool packs directly on the skin, as this can cause a burn to the patient. Wrap it in a tea cloth or a triangular bandage to avoid direct contact with the skin. C, provide comfortable support. With this, you need to apply soft padding over the area and bandage using a conforming or crepe bandage. This is done over the cold compress to hold it in place. Do not apply this too tight, as this can cause more pain and discomfort. Make sure it's not too tight by checking their circulation every 10 minutes. This can be done with a capillary refill by pushing on the skin past the injured area for 5 seconds until it goes pale. Then if the colour doesn't come back within 2 seconds, loosen and reapply the bandage. It may also indicate a more serious injury that needs professional assistance. Finally, E is elevate. Here we're going to elevate the wound to reduce the swelling. This could be on pillows, on a bag or in a chair. The next problem we have is whether to move the patient or not. In the case of a wrist or an arm, you can usually put the arm in a horizontal sling and move them quite easily once the initial treatment has taken place. But take care, as it may be that they're in a lot of pain and they may feel faint. So let them get up slowly and give them help where needed. If they have a leg or ankle problem, moving them may be very difficult and you may need to call for help. The person will not be able to put weight on the area, so you must make sure that you do not accidentally get them to stand on it. If they are moved, once the limb is no longer elevated, swelling and pain can increase. It may be that you could help them to hop to a place of safety. If not, stay with them until help arrives.